ARPA-H recently funded, I think it's 7 teams under a program that's called PROSPER, which stands for Proactive Solutions for Prolonging Resilience. And the big vision of PROSPER is to deliver an FDA pathway for gerotherapeutics and to be able to proactively intervene in people's aging trajectory before they develop age-related disease. The paradigm is right now, if you're feeling like your cognitive function or your physical function is like a little bit down, no one's going to do anything for you until you have a disease. Right. And so the idea would be to have like an adult health curve, analogous to the pediatric growth chart. Like, how are you aging? Are you where you need to be relative to people in your age? And if you're not, let's intervene now and be able to treat that now, because there's no pathway to do that right now through regular physician pathways. So the way that they've decided to do that is by focusing on this concept called intrinsic capacity, which has been mentioned a few times in this meeting, but I'll define it for our podcast listeners. So intrinsic capacity was developed in 2015 by the World Health Organization. So it's got the gravitas of that organization behind it. It focuses on all of the abilities available to an individual in order that they need to function. And it has 5 domains: physical function, cognitive function, psychological health, so mood, sensory function, eyes and ears, and vitality, which generally captures everything that's going on under the hood regarding inflammation and nutritional status. Intrinsic capacity is nice because it focuses on like the presence of function rather than frailty, which is the inverse, which is focuses on deficit accumulation. So it's a much more positive framing for aging. And I think all of us believe that if we have a gerotherapeutic, it should be broadly affecting how people feel, function, and survive. And those things underpin intrinsic capacity. And we all know, right, if someone starts to have issues with their vision or hearing, maybe they don't go out as much, or maybe they trip and fall, and all of those capacities all those domains are linked. And so ARPA-H is building on this WHO concept. I should also say that it has a diagnostic code in the ICD-11, which gives it a precedent elsewhere in the world, and so it just doesn't have a precedent here with FDA. And so there's a big regulatory piece of the program, and it was all designed around starting to engage. I was at an FDA event last week as part of this program, and so we're starting to really like knock on the door and try and push to see if this might be something that they might approve.
I think that's super important for this to be successful, is having these conversations with FDA early and often.
Yep, absolutely.
Instead of waiting till the end. Right?
Absolutely. So I think all signs are positive right now, and we'll be engaging with them throughout.